Hi, my name is Jandy Wainstead. I'm going to be doing my video validation on the insertion of NG tubing and the removal of it. What I want to do first is come in and check my patient. I'm going to go ahead and listen to the vowel sounds in all four quadrants. I'm going to check the patient's nasal passages and see if one is better versus the other, if the one's blocked or something's going on there. And then once I decide which side I'm going to use, I go ahead and take my tubing, and I want to measure how far the tubing needs to go down. So how I get an estimation of that is measure from the tip of the nose to the tip of the ear, and then from the tip of the ear down to the xiphoid process. I'm going to go ahead and mark that with a piece of tape so that I know how far down to go. And I've also got all my supplies here. I've got an emesis basin, I've got some box of tissues, I've got a glass of water for the patient, and my other NG supplies. So I've measured it, I know how far down I want to go. Then I'm going to take and put, well, first I'm going to bend it around so that it kind of matches the curvature of the neck. And I'm going to put some lubrication on the first 3 to 4 inches. And what I want to do is enter that first 3 to 4 inches. Hopefully the patient is right before the patient gags. If they do gag, just pull it out slightly. So I'm going to go ahead and put that in the nostril. They can just look straight ahead. I'm going to hold the tubing now in place, and I'm going to allow the patient to take a drink of water. Then I'm going to instruct the patient to swallow continuously until I reach my mark on my tape. So I'm going to tell them to swallow, 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 swallow. Once I get down to my tape, I'm going to go ahead and hold on to the tubing, take a piece of tape that I have split in the middle, put it on the bridge of the patient's nose, take one of the sides and wrap it around so that it's fastened there enough for me to do my checks. Now what I want to check on the patient is I want to listen as I insert 5 to 10 cc's of air right to the right of the xiphoid process. Hopefully I'm going to hear a swishing sound. I've got my 5 to 10 cc's of air in a 60 ml syringe. Go ahead and put it in the clear tubing. Insert the air. I should hear a swoosh. If I do not hear the swoosh, I can go ahead and aspirate 5 cc's of what I believe to be stomach content. So aspirate that little bit, take it out. And then I want to go over to a pH test strip. I'm going to put the stomach the contents on there. And then if it's between 0 to 4, I know that it is in fact stomach content and I'm in the right area. So I check that, and that's good. Now I'm going to go ahead and continue to fasten this to my patient's nose more securely. So I've got that on there. It's going to stay nice and tight on there. Then I want to take another piece of tape. I'm going to come around here, and I want to fasten the tape to the patient's gown with a pin through the tape with enough leeway so that the patient is able to turn their head. Then what I want to do before I connect the suctioning is remove this, hook up my tubing, turn on my suctioning. The tubing is going to go into the clear part. Then I'm going to take out my anti-reflux valve. I'm going to go ahead and enter 5 to 10 cc's of air into here to make sure that the tubing is not stuck to the lining of the stomach. Put this back in, and my patient is good to go with their NG tubing. Now if I come in later and something's wrong, where it looks, the abdomen looks distended or nothing is coming out of the suctioning tube, I need to listen to the valves once again, check all 4 quadrants, see if there's any activity going on in there. Then what I'm going to do is take 5 to 10 cc's of air, and I'm going to put it in the clear tubing, and I try to put it in and it will not go in. So I'm going to, first I disconnected the tubing after I shut off the Salem sub pump. Okay, so the suctioning is off. I tried to put in the air, but it will not go in. So what I want to do is take a new syringe, of course, every time. And I'm going to take 30 cc's of water. Then I'm going to come back over to the clear tubing, and I'm going to take it with one hand. I'm going to grab the tubing and the tip of the syringe, 60 ml syringe, and I'm going to pump it to try to break the clot free. And then once it does go in, I am good. I want to again aspirate 5 cc's of stomach content, and I'm going to go over to my pH test strips again. I'm going to put the contents on there, and I'm going to check again to make sure that it is between 0 and 4, so that I'm still in the right area in the stomach content. Then I'm going to go ahead and reconnect my suctioning, turn it on, take out the anti-reflux valve again, and I'm going to put in another 5 to 10 cc's of air into the blue tubing to make sure again that it's not on the stomach lining wall. Put this back in, and the patient is once again fine. I can see stuff coming out. Everything looks okay. Now, when I come in and it is time to discontinue the NG tubing, what I want to do is disconnect my tubing after I shut off the suctioning, and then I'm going to go ahead and assess for all sounds again, making sure that there's activity in all 4 quadrants. Take out my anti-reflux valve that I put in here. And this time, I still need to make sure that I am in the stomach. So I want to aspirate another 5 cc's of stomach content. Oh, first I would enter the air. I'm sorry. 5 to 10 cc's of air. Listen for the swooshing sound with my stethoscope, right to the left of the xiphoid process. And then if I do not hear the swishing sound again, I can aspirate some of the stomach content, 5 cc's. Go ahead and go over my tester. Again, always grab a new syringe. Put the contents onto the test strip. If it's between 0 and 4, I know it's in the stomach, everything is where it needs to be. Then I can go ahead and take 20 cc's of air, air, and 20 cc's of water. And I'm this time going to make sure I hold this up and down so that the water's on the bottom, the air is on the top. And I'm going to flush out any bile that is in the tubing with the water. And then with the air, I'm going to flush out any water remaining in the tube. So I'm going to go ahead and push all this in. Everything's cleared out, looks good. I'm going to go ahead and leave this connected this time. Put that down there. Actually, before I did that, I'm sorry, I need to back up just 1 second. Before I put the 20/20 in, I would do the 5 to 10 cc's of air in the blue tubing to make sure that it's once again off of the stomach lining. So, I made sure it's not on the stomach lining anymore. I put in my 20 cc's of air and water. The patient's now ready to have this taken out. And what I want to do is go ahead and take the tape off the bridge of the nose. Still holding the tubing. I want to go ahead and ask my patient to take a deep breath and hold it. And while they're holding their breath, I am then going to go hand over hand as I pull it up. So they're holding their breath, and I'm pulling it out, pulling it out. Everything looks good intact. Go ahead and take this, hold it up, discard it, and then I would go ahead and do good oral cares on my patient and also do my charting. Thank you.